Your belt notch creeps outward, your energy dips after lunch, and lab numbers whisper warnings. What if the gentle slice of bread you trust is steering blood sugar like a roller coaster? In Wheat Belly's world, we meet modern wheat as a quiet accelerant of cravings and belly fat. Tonight, we travel from kitchen to bloodstream, where tiny choices turn tides. If your health is complex, please consult your physician before changing your diet. A bagel, orange juice, and a promise to do better. Within minutes, starch breaks to glucose, insulin rises, and the belly files away energy as visceral fat. Many modern wheat products digest quickly, stirring hunger again. For those facing metabolic syndrome, high waist size, triglycerides, blood pressure, or glucose, these swings matter. Before any changes, especially with medications, speak with your healthcare professional. You eat, yet feel unsatisfied. Like a whisper in the pantry, refined wheat can prompt faster blood sugar rise than many expect, which can amplify appetite later. Picture your hunger as a thermostat. Rapid spikes make it overshoot, then crash, urging you to refill. Some people notice calmer appetites when they reduce refined flour. If you manage diabetes or hypertension, coordinate dietary adjustments with your physician. Imagine a city of signals: blood pressure like rush hour traffic, triglycerides as delivery trucks, insulin as dispatch. Metabolic syndrome clogs the streets, waist expands, HDL falters, glucose stalls. Refined carbs can worsen congestion. Our aim is not blame, but better traffic flow. If you have any cardiovascular risk or take medications, please seek medical guidance before changing your eating pattern. Here's the twist. Many wheat foods digest quickly, acting in the body surprisingly like sugar. It's not moral failure, it's biochemistry. If your afternoon crash feels scripted, perhaps the script was baked. Keep watching. We'll test a small experiment that might quiet cravings in days, not months. For those on insulin or glucose-lowering drugs, talk with your healthcare team before trying any dietary change. High-yield wheat varieties brought abundant harvests, yet their flour is finely milled and rapidly absorbed. That rapidity may stimulate hunger cycles in susceptible people. Think of kindling versus logs. Refined flour burns fast. Whole foods rich in protein, fiber, and healthy fats burn slow. If you have celiac disease or allergies, require testing or diagnosis, please consult a physician first. Blood sugar is not just numbers, it's mood and momentum. Rapid spikes can be followed by dips, bringing fatigue and irritability. Over time, repeated surges nudge insulin higher, storing more energy as belly fat. Many people report steadier energy when refined wheat is reduced. If you monitor glucose at home, consider tracking changes and review them with your clinician. Hunger can feel personal, yet chemicals steer it. Some research suggests wheat components and fast-absorbed starch may influence appetite signaling. Imagine radio towers, ghrelin, leptin, insulin, broadcasting mixed messages after a sweet rush. When meals slow the rise, protein, veggies, healthy fats, the signals can harmonize. For complicated conditions, seek medical advice before adjustments. Visceral fat is not just storage, it's active tissue-releasing signals that can promote inflammation and insulin resistance. Refined carbohydrate patterns can feed this depot. Picture an uninvited neighbor adding noise to every room. Many find that reducing refined flours, plus walking after meals, helps. If you have joint, heart, or glucose concerns, consult your doctor about safe activity. When blood sugar and insulin surge frequently, inflammatory pathways may flicker on, like embers under the surface. Over time, embers can warm the whole house. Joints ache, brain fog lingers. A lower refined carb plate often feels like a cool breeze. Before significant changes, especially if you take anti-inflammatories or anticoagulants, discuss plans with your physician. Belly fat doesn't arrive overnight. It's a diary written in snacks, late-night bites, and well-meant low-fat muffins made with extra flour. The story can be revised. Many people start with one swap at breakfast and a short walk. Simple, repeatable, compassionate steps. If you have hypoglycemia episodes or medications that affect glucose, plan changes with your care team. Labels can mislead. Whole wheat may still produce a brisk glycemic rise, not as gentle as many imagine. Fiber helps, but flour's surface area speeds digestion. Imagine sawdust versus planks. The finer the pieces, the faster the burn. Some individuals feel steadier by favoring intact foods: vegetables, legumes, nuts, seeds. If you have digestive disorders, consult your physician before major shifts. Visualize a plate as a traffic controller: protein for steadiness, colorful vegetables for fiber and micronutrients, olive oil or nuts for satiety. This trio slows glucose entry and can ease hunger rebound. Many choose to limit refined wheat to test their response. If you take glucose-lowering medication, ask your doctor about monitoring to prevent lows. Consider a 14-day wheat holiday to observe your body's language: hunger intensity, afternoon crashes, waist comfort. This is not forever. It's a listening tour. Keep a simple journal. If you have celiac concerns or require diagnostic clarity, seek medical evaluation before removing gluten, as testing accuracy can be affected. Safety and clarity go hand in hand. Breakfast sets your metabolic tempo. Swap toast and jam for eggs with greens, Greek yogurt with nuts, or tofu scramble with veggies. These options often slow glucose rise and curb mid-morning cravings. Start with what you like. If you're on morning medications, coordinate timing and content with your clinician to avoid interactions or hypoglycemia. A grain-heavy sandwich can be replaced by a bowl: leafy base, roasted vegetables, beans or fish, seeds, and olive oil. Many find energy steadier into the afternoon. The goal isn't perfection, it's observing your body's signals. For those with kidney or cardiovascular conditions, individual protein and sodium needs vary. Please consult your physician for tailored guidance. Evenings, ask for calm. Center dinner on non-starchy vegetables, moderate protein, and healthy fat. If you include starch, choose a modest portion of slow-digesting sources and pair with fiber-rich sides. Many find sleep improves when heavy refined carbs fade. If you have reflux or sleep apnea, ask your clinician about supportive meal timing and portion strategies. Snacks are bridges, not banquets. A handful of nuts, a boiled egg, or hummus with peppers can steady you without a sugar surge. Many notice that balanced snacks reduce the magnetic pull toward pastries. If you have gallbladder or lipid issues, discuss fat choices with your clinician to align with your health needs. Sometimes, thirst dresses as hunger. Before reaching for crackers, sip water or herbal tea. Adequate hydration supports metabolism and may soften the urge for fast carbs. Add a pinch of citrus or mint for delight. If you're on fluid restrictions or diuretics, please follow your physician's guidance on safe intake. Wheat hides in sauces, soups, even candy. Scan for words like wheat flour, semolina, malt, modified starch. Simpler ingredient lists often mean fewer surprises. This is a skills game, not a purity test. If you have allergies or require strict avoidance, seek a registered dietitian or clinician for safe routes. Day 3 of your wheat holiday, an odd calm arrives at 4 p.m. Snack cravings soften. Is it placebo or physiology? For many, fewer fast carbs means fewer spikes, fewer crashes. Keep watching this trend and note your hunger score in a journal. If you feel dizzy or weak, pause and contact your clinician for guidance. A 10-minute walk after meals can temper post-meal glucose. Muscles act like sponges, soaking up sugar without extra insulin. Imagine wringing out a towel gently, not forcefully. If you have mobility limits or heart concerns, ask your doctor for a movement prescription tailored to you. Protein slows digestion and sustains satiety. Think of it as an anchor that keeps your ship steady in choppy glycemic seas. Fish, eggs, tofu, yogurt, or legumes can play this role. Pair with vegetables and healthy fats. For kidney disease or specific medical conditions, confirm protein targets with your physician. Soluble fibers from vegetables, legumes, and seeds form a gentle gel that slows glucose entry, helping reduce spikes. Imagine a soft filter between meal and bloodstream. Many people feel steadier with these choices, especially when refined flour fades. If you have IBS or GI sensitivity, Adjust fiber gradually and seek clinician advice. Healthy fats, olive oil, avocado, nuts, support fullness and smooth blood sugar curves. They're not a free-for-all, but a tool for satiety. Picture oil as a velvet rope, slowing entry to the bloodstream. If you manage cholesterol or take lipid-lowering therapy, discuss fat patterns and labs with your clinician. When refined wheat and sugars recede, taste buds sharpen. Berries taste brighter. A square of dark chocolate feels decadent. Your palate is plastic. It learns. Use sweetness like spice, not staple. If you track glucose, notice your post-dessert numbers and review them with your care team. Short sleep nudges hunger hormones. Ghrelin up, leptin down, making pastries shout louder. Protect 7 to 9 hours when possible. A darker room, earlier screen off, and a consistent routine can help. If you have insomnia or sleep apnea, seek professional evaluation. Sleep care is metabolic care. Stress hormones raise glucose to fuel a run, even if you're seated. Chronic stress may push appetite toward quick carbs. Try a 2-minute breathing practice before meals. It often lowers the volume of cravings. If anxiety or depression affects eating, consult your healthcare professional for support. Make the easy choice the default. Place vegetables at eye level, nuts in small jars, and bread out of sight. Prepare a protein-rich snack before hunger roars. Systems beat willpower. If you share a home with different needs, consider separate shelves and clear labels, and consult a dietitian for family-friendly plans. At restaurants, ask for lettuce wraps, veggie sides, or a bowl built without bread. Sauces can contain flour. Request on the side. Savor company and conversation. You're learning, not restricting life. For celiac disease or severe allergies, emphasize cross-contact rules and consult professionals for safe dining strategies. Celebrations carry cake and love. It's okay to plan your portion or choose alternatives. Bring a fruit platter or cheese board. If you decide to taste, pair with protein to soften the sugar rise. No guilt, just data. If you use insulin or sulfonylureas, discuss strategies to prevent lows and highs with your clinician. Before eating, pause and rate hunger. 1-10. Under 4, try water or a short walk. Over 6, build a balanced plate. This simple practice rewires autopilot. Over time, many feel fewer urgent cravings when refined wheat fades. If you struggle with disordered eating, seek specialized medical guidance. If you have a glucose meter, compare 2 breakfasts on different days. Bagel versus veggie omelet. Track 1 and 2 hours after eating. Many will see a calmer curve with protein and vegetables. Share results with your clinician to personalize your plan. If you don't monitor, simply note energy and hunger. And when biology drives craving, willpower frays. By reducing foods that spark fast spikes, often refined wheat and sugars, you change the signal itself. Less noise, fewer battles. Build environments, routines, and backups. For those with complex medical histories, consult your physician for safe, sustainable pacing. Different bodies, different thresholds. Some thrive when wheat is minimized. Others tolerate small amounts alongside fiber, protein, and movement. Use your data, hunger, energy, waste, labs, to choose. If you have nutrient deficiencies or medical restrictions, discuss grain options with a clinician or dietitian. Magnesium, potassium, and B vitamins support metabolic calm. Colorful vegetables, nuts, seeds, and legumes shine here. Think of micronutrients as tiny mechanics keeping the engine tuned. If you consider supplements, review interactions and dosages with your physician to avoid overuse or conflicts. Many boxed cereals, whole grain included, are finely milled and sweetened, producing brisk sugar rises. Your body hears sirens, not symphonies. Swap for eggs, yogurt bowls, or chia pudding. Choose the option you'll repeat. If you have lipid concerns, tailor fat and fiber with your clinician. Higher intake of refined carbs can raise triglycerides and promote small, dense LDL particles, which are more atherogenic. Lowering refined flours and sugars often improves these markers for many. Lab numbers tell a story. Let your clinician help interpret and guide next steps. Some people report digestive relief when they reduce wheat, while others notice no change. Gut microbiota thrive on diverse fibers from vegetables and legumes. Feed the garden inside you. If you have chronic GI symptoms, seek medical assessment to rule out celiac disease, IBS, or other conditions. A few techniques: sheet pan roasting, simple sautés, and hearty salads turn weeknights from rush to ritual. Cooking reduces hidden flours and sugars and boosts control. Light a candle, plate with care, and let appetite cues catch up. If you have special dietary needs, get personalized recipes from a clinician or dietitian. After 14 days, review hunger scores, afternoon energy, waist fit, and any glucose logs. Did cravings ease? Is sleep gentler? If you see benefits, decide how to continue: strict, flexible, or selective. For medication users, share outcomes with your clinician to adjust safely. If you test wheat again, introduce a small portion in a calm meal and observe hunger, mood, and energy for 24 hours. You're collecting clues, not passing judgment. Some feel fine, others note cravings return. If you have medical reasons to avoid gluten, follow your clinician's advice instead. The scale is a noisy narrator. Waist circumference, fasting glucose, blood pressure, triglycerides, and HDL tell a clearer tale of metabolic risk. Reducing refined wheat and sugars may nudge these in the right direction for many. Partner with your clinician to track progress and refine steps. Whether it's walking, dancing, swimming, or cycling, the best activity is the one you repeat. Aim for frequent, gentle movement and sprinkle in strength training. Muscles are metabolic allies. If you have orthopedic or cardiac issues, seek a personalized exercise plan from your physician. Spices, citrus, herbs, and umami give meals joy without relying on breading. Roast cauliflower with paprika, dress salads with lemon and olive oil, and add mushrooms for depth. Pleasure is a strategy. If sodium is a concern, tailor seasonings with your clinician or dietitian. A donut happens. Note the time, hunger level, mood, and what helped next time. Curiosity beats shame. Many realize that a protein-rich snack earlier would have diffused the craving. Share patterns with your clinician to build resilience, not rules. Food is identity. If bread anchors tradition, preserve meaning while easing spikes. Smaller portions pair with protein and greens. Savor slowly. Rituals can evolve and still honor roots. For medical restrictions, seek culturally sensitive guidance from your healthcare professional. One morning, you notice your ring slide on easier, you climb stairs without pausing, and the 3 p.m. fog is thinner. These are metabolic love letters. Keep them. If you track labs, schedule a follow-up to see if numbers echo how you feel. Always coordinate care with your physician. From wheat holiday to mindful reintroduction, from post-meal walks to sleep routines, you've built a playbook. Keep what works, release what doesn't. Health is a living document. For chronic conditions or medications, refine your plan with your healthcare team. Your story is not about losing bread. It's about gaining mornings, clear focus, and a steadier heartbeat. Try a 14-day wheat holiday, journal your signals, and share results with your physician. If this film helped, please subscribe, like, and share. Your next small step could be the hinge that swings the door of health wide open.